aspiration catheter that was being tested in the French study is already available in the United States. How has it been until now used compared to stent retriever type of devices for embolectomy and treating acute ischemic stroke?
So the aspiration catheter is available. There have been studies that shown that it's efficacious, and it's in the cycle of devices that was probably just before the stent retrievers. As you know, the stent retriever trials 2 years ago at this meeting were so positive that many people have moved to deploying stent retrievers more frequently in acute large vessel occlusion. I think this study, the ASTRA trial, does show us in a head-to-head comparison that the aspiration device versus the stent retriever in this French population is as safe and as good at opening up those vessels in the acute period.
So, do you think at this point that these data are enough to convince U.S. practice to change, or?
Well, I think right now we're awaiting another trial, a trial in the U.S. that will be comparing a head-to-head comparison. They're a little bit behind the ASTRA trial. As we heard, they're about 2/3 through in the COMPASS trial, and so we're awaiting that trial, which will be a head-to-head comparison. As I said earlier too, a lot of it depends on the technician, the interventionalist deciding what they feel most comfortable with, but at the moment, given our guidelines, given the trials that are out there, stent retrievers are still probably the most prominent device used to open large vessel occlusions.
Right. There was an interesting comment, though, at the press conference that one operator was saying he actually uses the device in combination in selected patients. So do you think that U.S. interventionalists are using aspiration to some extent right now?
There may be some, because of the familiarity with the device, that are using it. Remember, though, when we use two devices, we can increase costs.
Yes.
So you're using one device, which has a cost, and then another device. However, if you can open up the vessel with the aspiration device and you're good at it, and it does, like the ASTRA trial, can be done just as quickly and just as efficacious, it may be a option for you to use. I think we still have to await the head-to-head comparisons that are out there in terms of the use. And I think it would be nice to know whether there are certain select patients in the U.S. that you would prefer one device over the other. For example, in the United States, we see more intracranial atherosclerosis, and I would wonder whether aspiration would work as well in somebody that has a blockage in that artery that's not a clot compared to a stent retriever. This is the kind of thing that I think new studies will hopefully tell us.
Right. And one other thing that actually occurred to me was the quality of the embolus, of the clot itself. Does it have to be a soft clot to be amenable for aspiration?
Usually for an embolus, I remember these patients are acute. There's a clot that goes into a rather large artery in the brain, the middle cerebral artery, and it's happening within 6 hours. Many of them are soft, fresh clots. But you're right, to aspirate and get it in that catheter, it has to be a little bit of a malleable clot, presumably soft, presumably a fresh clot. If it was what we call a white clot coming from atherosclerosis that's harder to aspirate, that's where an aspiration device may have more difficulty. And that's why the atherosclerotic stenosis cases, intracranial stenosis cases, could be a little trickier with aspiration versus stent retriever. But again, we need more evidence for direct comparisons in American patients.